never seen primary care in the state that it is now. Patients calling repeatedly to get an appointment day after day after day. Doctors under incredible strain, often burnt out. Many leaving the profession or going part-time. Practices closing down. All of which puts more strain on those who remain. Even pharmacies are closing down. The ramifications on the rest of the NHS are evident too. Ambulances queued up outside hospitals, long waits at A&E, long waits for treatment, even longer waits for mental health treatment. And social care, thousands of people without a care package, stuck at home or stuck in hospital, which also compounds the problem of the NHS. And now the nurses are on the verge of a strike. They never go on strike. And that's how bad it's become. The situation is incredibly dark. The BMA talk of breaking point, burnout, demoralisation and departure. Yes, the pandemic had an impact. I'll agree with the Health Secretary on that. But the government's negligence and complacency over many, many years are far bigger factors. The former NHS Scotland Chief Executive Paul Gray says these problems have been building for years, well before the pandemic. Let's remind us what he said. The current system was going to be overwhelmed regardless of COVID. The virus has simply brought the date of that event forward. And the reasons, after 15 years of this government, include inadequate reforms, poor workforce planning for the multidisciplinary team, refusing to recruit enough GPs for years, cutting the number of nurse training places, failing to eradicate the delayed discharge that they promised in 2016. You should listen to this list. This is an important list. Undervaluing the social care year after year after year, delaying the mental health strategy and the spending associated with it,